What if I told you that some of the most popular supplements for arthritis barely work, while others could actually reduce your pain, stiffness, and improve how you move? And even worse, some supplements on the market may not even contain what the label says. Today, here at Arthritis Channel, we're breaking down the 3 most effective supplements for osteoarthritis based on real clinical evidence, plus 1 critical mistake you must avoid before buying any of them. Stay with me until the end, because this could completely change how you manage your joint pain. Many people turn to supplements because they're seen as a more natural approach to treating arthritis. But here's the truth: not all supplements are created equal, and the science behind them varies a lot. So let's go straight to what actually shows promise in research. 1. Boswellia Serrata. Let's start with one of the most underrated options, Boswellia Serrata. This is a plant extract derived from the frankincense tree, used for centuries in traditional medicine. But what matters is this: modern research suggests it has real anti-inflammatory and pain-relieving effects. It works on similar inflammatory pathways as medications like ibuprofen, but without the same level of side effects. Clinical studies, including systematic reviews, have shown that Boswellia can reduce joint pain, decrease stiffness, improve joint function. Some analyses even found moderate to large improvements in symptoms compared to placebo. Typical dosage: around 100 to 250 milligrams per day, usually taken with your first meal. And overall, it's considered relatively safe, but always check with your healthcare provider, especially if you take other medications. 2. Turmeric and curcumin. Next up, one of the most researched natural compounds, curcumin, the active ingredient in turmeric. Curcumin has powerful anti-inflammatory, antioxidant properties. And here's where things get interesting. Several studies show that curcumin can improve pain, stiffness, joint function, and in some cases, its effects were comparable to common anti-inflammatory drugs like ibuprofen or naproxen, but with fewer reported side effects. Important note: while promising, results can vary depending on formulation and absorption. Typical dose used in studies: about 1,000 milligrams per day. This makes curcumin one of the strongest natural options available right now. 3. Glucosamine plus chondroitin. Now let's talk about the most controversial one: glucosamine and chondroitin. These compounds are naturally found in cartilage and joints. You've probably seen them everywhere. But here's the reality: the scientific evidence is mixed. Some studies show reduced pain, improved function, but others show no difference compared to placebo. However, when these two are taken together, some research suggests a small to moderate benefit, especially for knee and hip osteoarthritis. Typical doses: glucosamine, 1,500 milligrams daily; chondroitin, 800 to 1,200 milligrams daily. If you try them, take them together, not separately. But if you're choosing where to start, evidence suggests Boswellia and curcumin may be more effective. Quick question: which supplement are you currently taking? Let me know in the comments. And if this is helping you so far, make sure to subscribe to the channel and turn on notifications. We post science-based joint health content every week. What about other supplements? You might be wondering about things like vitamin D, omega-3, type 2 collagen. Here's the honest answer: they may help slightly, but overall, the effect size tends to be low. Collagen in particular is still being studied, and current evidence is not strong enough to put it ahead of the top options we discussed. Critical warning: supplement industry. Now this might be the most important part of this entire video. Supplements are not strictly regulated. That means labels can be inaccurate. Ingredients may not match what's listed. Some products may even contain banned substances. In fact, studies have found that a large percentage of supplements don't accurately disclose their contents. So what should you do? Look for third-party certifications, such as NSF, USP. These organizations independently verify ingredient accuracy, purity, safety. It's one of the best ways to protect yourself. And remember, supplements are just one piece of the puzzle. The biggest improvements in arthritis usually come from lifestyle changes, exercise, weight management, proper medical treatments. If you really want to improve your joint health, watch our next video, where we break down the most effective treatments beyond supplements.